everyone. On today's podcast, we're going to talk about the evidence on skin-to-skin care after a cesarean. Hi, everyone. My name is Rebecca Decker, pronouns she, her, and I'll be your co-host for today's episode. Today, along with Sara Ailshire, my co-host, we are excited to bring you some brand new evidence-based information all about the evidence on skin-to-skin care in the operating room after a cesarean. As a content note, we will be discussing preterm birth, NICU stays, separation of parents and babies, infant mortality rates, and the impact of racism on cesarean rates and breastfeeding. Sara Ailshire, who's here with me today, pronouns she, her, is a doctoral candidate in anthropology and the 2023 EBB Research Fellow. Sara was awarded a Fulbright Student Research Fellowship to go to India in 2020 when she had the opportunity to learn from birth professionals about their work to support people in childbirth in India, and she also took that time to train as a doula there. Sara, I'm so excited to have you here with me today on the EBB podcast.
Thank you so much for having me. I'm excited to be here speaking with you today.
And even though you haven't heard Sara's voice yet, you have been hearing her work on the podcast because she helped me updates on nitrous in episode 273 and also premature rupture of membranes in episodes 277 to 81. And now Sara's latest project at EBB has been updating the evidence on skin-to-skin care with cesareans. So just to give you an overview of what we're going to cover in today's podcast, we have a lot of research to talk about with you. We're going to start first by giving you an outline of the signature article on skin-to-skin care after a cesarean. And after that, then we'll dive into more depth about the benefits of skin-to-skin care after cesarean, barriers to getting this best practice, some of the newest, most interesting research studies. We'll talk a little bit about gentle cesareans, professional guidelines, and then we'll share with you the bottom line on skin-to-skin care after cesarean. All of this information is on our website at evidencebasebirth.com/cesarean care. We will also link to it in the show notes, and there is a new one-page handout all about the evidence on this topic that anyone can download for free on that webpage. So, Sara, let's get started. Can you tell our listeners a little bit about what was covered in this article and some of the info that you updated?
Absolutely. So the article covers a lot of ground. We start by discussing the history of separating birthing people from their babies. This is something that's really unique to the biomedical culture of the 20th and 21st centuries, which saw birth move into the hospital setting, saw the introduction of anesthesia, and a need for a new type of place to safely keep babies as birthing parents recovered. Researchers in the 1960s and the 1970s identified this type of research as a problem, and their work started to push back against routine separation. In the 1970s, doctors in Colombia developed something called kangaroo care, which is an intervention to keep premature babies alive by keeping them in constant skin-to-skin contact with their birthing parent. This was a really successful approach to caring for very, fragile newborns. The success of this intervention got international attention and changed things globally when it comes to skin-to-skin care. It's something that's still really widely practiced today. Then in the article, we get into the most up-to-date data available to us about cesarean rates, as well as the rates of separation after cesarean. The chance of having skin-to-skin care after a cesarean birth is much lower compared to a vaginal birth, because when it comes to cesarean births, routine separation is still routine. In the United States, the cesarean rate in 2022 was 32%. We found that cesarean rates within the United States are also not the same for all communities, with people of color having higher cesarean rates overall. Because of this, and because of the additional barrier that poses to access to skin-to-skin care, the article includes resources and links that will connect our readers with Black and Indigenous leaders and support networks in lactation and birth care. While working on this article, it was really interesting for me to learn all about the different approaches to cesarean births, especially ones that prioritize the birthing parent and the baby. In the update, we discussed gentle cesareans, which is a type of cesarean that supports skin-to-skin and bonding between the birthing parent and the baby, sometimes even before the incision is closed. Now we start moving into the evidence, and we really start digging into everything that's changed since the last time we updated this article. First, we look at the benefits of skin-to-skin care. We talk about if there are any risks to skin-to-skin care after cesarean and what those might be. Then we look at what skin-to-skin care after cesarean birth can look like, the latest research on this, as well as the research on why some providers are reluctant to provide birthing people with skin-to-skin care after a cesarean. Something that was really interesting for me as an anthropologist was that researchers were finding that a lot of the barriers were about the culture of an institution rather than concerns about risk necessarily. We also highlight some of the successes that medical providers and hospitals have had in implementing skin-to-skin care after cesarean in their facilities. And we detail what that process looked like for them. One other thing that's new in this edition of the article is that we've included some recommendations from different professional organizations in the US, the UK, and Australia regarding skin-to-skin care after cesarean. We found that professional organizations recognize the benefits of skin-to-skin care and support implementing this practice after cesarean births.
Yeah, thank you, Sara. It was a really comprehensive update, and it was really exciting to see everything that had changed in the last 5 years since we most recently updated this article. Actually, it was 6 years ago. And before that, the article was originally published in 2012. And at the time, skin-to-skin care in the operating room was a very new practice. So now we have about a decade of research that we've added to the article since that time. One more note before we dive deeper into the evidence. I want to let you know a content note about lactation and inclusive language. So here at EBB, we seek to honor and celebrate all families and to provide evidence-based content that supports you in your pregnancy and parenting journey. And so our goal in writing this article was to write it in a way that acknowledges and honors the hardships and power of all groups. And so we make frequent references to the research on lactation. And many of the studies that we cite use the term breastfeeding. When we're discussing results from specific studies, we will use their terms to ensure that I'm as accurate as possible when we're sharing research with our community. And when we're not citing the literature directly, we will use inclusive language for lactation. So one newer term that some of you may not be familiar with includes the term chest feeding. This is an inclusive term for the act of nursing promoted by the National Institutes of Health, La Leche League USA in Canada, and the Academy of Breastfeeding Medicine. Chest feeding can include feeding at the nipple, milk extraction from remaining tissue in someone who's had top surgery or breast reduction surgery, or the use of supplemental nursing systems, which is a small tubing attached to the breast or chest that allows a baby to feed or simulate feeding at the nipple while also receiving supplemental formula, expressed milk, or donor milk. We also use the term body feeding. This encompasses a wider variety of methods that parents use to nourish their babies from their bodies, including breastfeeding, chest feeding, and pumping. So we know here that language changes over time. And as our community innovates to find the best ways to inclusively describe ourselves and our bodies, we will do our best to keep pace. And I'll link in the show notes to a couple other podcast episodes you can listen to about this topic. So I'm going to start by diving into the research on the benefits of skin-to-skin care. I think it's really important for our listeners to know that skin-to-skin care benefits everyone, no matter what type of birth you have. And there is so much research on this. It's a pretty well accepted fact in the literature. And one of the most important studies on this was a 2016 Cochrane review where they combined the results from 46 randomized controlled trials that included nearly 4,000 birthing parents and their babies. 8 of the 46 trials included cesarean births, and 6 of them included late preterm births. So we had cesarean births, vaginal births, preterm births, term births. And when all of this research was combined, there was strong evidence that skin-to-skin care positively influences breastfeeding. So parents who had skin-to-skin care with their infants were 24% more likely to still be breastfeeding at 1 to 4 months after giving birth, compared to parents who were given standard care, which does not include skin to skin. They also tended to breastfeed longer by about 64 days on average, and they were more likely to exclusively breastfeed after the birth for up to 6 months. Babies were also more likely to have their initial first feeding go well, and they also had better blood sugar levels, which is important because if a baby has a low blood sugar level, they're more likely to be given formula, which can then interfere with breastfeeding. Overall, the babies that had skin-to-skin care had better combined scores for their heart rates, breathing, and oxygen level in the first 6 hours after birth. So skin-to-skin care helps stabilize newborns and also encourages and helps the process of breastfeeding. Unfortunately, some babies who need skin-to-skin care most are the ones who are least likely to get it. So early skin-to-skin care, when it's given early after birth, is rarely provided to preterm or sick or medically fragile babies, but in fact, it benefits them. And researchers have found that there's higher stress levels or cortisol levels in infants who are not being held skin-to-skin by their parents after birth. And a large study in Canada, published in 2012, found that when babies are critically ill and they're separated from their parent, they actually have a higher mortality rate. So keeping babies and their parents together can be a life-saving practice. Also, they think that skin-to-skin care can really help a baby that's having medical complications or who's preterm stabilize. So it's reducing stress and it's using the parent's body to provide consistent warmth, comfort, and nourishment. It also has a positive impact on the birth experience. There's research showing that the care you receive during birth can have long-lasting implications for your mental health and for your bond with your baby. So it's important to pay attention to what is being provided, the practices that are being provided in childbirth, and support practices like skin-to-skin care that improve that childbirth experience. There was a study in 2019 with more than 3,000 participants where they found that if you had a cesarean and held your child shortly after birth, that you reported a better birth experience overall, and their rates were even higher than those who birthed vaginally in terms of their satisfaction levels. And this team also found that if you included a doula or a midwife, you're more likely to see or hold your newborn immediately after a cesarean. And in a study with more than 1,300 women in Israel, skin-to-skin care had the greatest positive impact on satisfaction after having a cesarean. So it was like the single most important thing you could do to have a better experience. So to summarize, if you're the person having the baby, you're more likely to have a longer duration of breastfeeding, more likely to exclusively breastfeed. You're less likely to have chest engorgement and pain at 3 days after birth. You're less likely to have anxiety after the birth, and you have higher satisfaction after the birth. For babies, they actually suckle more effectively in their initial feeding session if they're being held skin to skin or have early skin to skin care. And babies who have skin to skin care actually cry less when they are held skin to skin. They're 12 times less likely to cry during that initial period. Their heart rate, breathing, and oxygen levels are more stable, and they have better blood sugar levels. You could also flip that and say that there are risks or harms to not providing skin-to-skin care. And you could say that not providing skin-to-skin care makes it less likely that you will breastfeed of a certain duration. It means that your baby will have lower blood sugars, that they will cry more during this initial transition period to the outside world. So although we can frame it in terms of benefits, we can also frame it in terms of risks to not providing this care. And the benefits of skin-to-skin care are so clear that the World Health Organization recommends that all newborns receive skin-to-skin care, including low birth weight and premature babies, that it should begin immediately after birth and continue uninterrupted for at least 1 hour or until the first feeding session. So, Sara, I know there's more we'll get into later with some of the newer studies. Do you mind talking about with our listeners? So even though I just described this huge body of research that shows skin-to-skin care is important, including for people who have cesareans, why is it not practiced everywhere?
Absolutely. Yeah. So as you've said so well, We know that skin-to-skin care after a cesarean is beneficial. So why is it so common for us to hear or for us to see online parents say that they weren't given this option? For the signature article, we looked into the research on providers themselves and their beliefs about skin-to-skin care after cesarean to help answer this question. There are a few reasons that hospitals or providers may resist offering skin-to-skin care after cesarean birth. One of the main reasons is that providers and administrators sometimes believe that skin-to-skin care in the operating room can pose a risk to the parent or to the baby. Some hospital staff worry that an operating room is too cold for a newborn. And because babies born after cesarean are sometimes more prone to hypothermia or a too low body temperature, that combined with the coldness of the operating room makes them feel that it's just not safe. The baby won't be able to stay warm. Other times, hospital staff might worry that a person who's just had a cesarean birth is not in a good place to hold their baby. They might not be feeling well, they might be woozy or feeling a little nauseous. They might not be able to secure a brand spanking new slippery wet baby on their chest. So they worry, about the risk of dropping or slipping the infant. They also worry about risks to the birthing parent themselves, especially the risk of infection. When you're having a cesarean, you have, a large opening in your body, and skin-to-skin care immediately after birth would mean that the surgical drape is lowered and the baby is brought to your chest, and they worry that they won't be able to maintain what they call the sterile field, or the clean space around that incision that they want to keep clean so you don't get an infection. And those are the fears and the anxieties that are oftentimes a barrier to skin-to-skin care. But the research tells us something a little different. In a 2018 feasibility study of 91 baby-parent pairs, researchers at a hospital in California found that 53%, or 54 of the infants who were born via cesarean who received skin-to-skin care after birth either maintained their body temperature or even saw an increase in their body temperature. So over half of the babies in this study weren't, freezing in the operating room. They were staying warm or even getting warmer. While 40% or 44 of the babies in this study had a slight decrease in temperature, only 4 of the 91 had a significant enough decrease in their body temperature that it required an intervention that interrupted skin-to-skin care. So this tells us that, the risk of hypothermia, the concern about cold babies might be not as big of a threat as some might believe. Another thing that's important to remember is that there are things that providers can do to help reduce this risk of babies getting too cold in the operating room during skin-to-skin care. They can keep warm blankets in the operating room ready to place on top of the birthing parent and the baby. They can also use warm forced air to keep the birthing person and the baby warm without changing the ambient temperature of the operating theater. Another perceived risk is that it might be difficult to maintain the sterile field or to prevent infections of the cesarean incision during skin-to-skin care after cesarean. One study of 243 people who had an elective cesarean found no real difference in surgical site infections between those who underwent a gentle cesarean, which we'll talk about later, but basically means, a cesarean birth where the baby is brought to the chest, and those who underwent a traditional cesarean section. Another study we looked at included 650 birthing people who had both elective and emergency cesareans. In this study, the researchers wanted to compare those who had immediate skin-to-skin care after cesarean with those who received standard care. The immediate skin-to-skin care group was 285 participants, and the standard care group was 365. They found that the rates of infection were really low overall, with just 6 people in each group reporting a surgical site infection. Something that was really interesting in this 2017 study was that the length of time spent in surgery and the average recovery time were shorter for those who had immediate skin-to-skin care. And of the babies in this study, those who received immediate skin-to-skin care had fewer admissions to the NICU compared to those who were separated from their parent after birth. So again, the risk of a surgical site infection with skin-to-skin care is not significantly higher for those parents who have immediate skin-to-skin care after birth versus those who undergo the typical period of separation immediately after a cesarean. Aside from the concerns about skin-to-skin care after cesarean being risky, researchers tended to find that other barriers to implementing skin-to-skin care after a cesarean were oftentimes tied to institutional culture and to questions of logistics, so things like staffing and space. In interviews of medical staff, researchers were told that it was hard for providers to change their routines to facilitate skin-to-skin care after birth. Making these changes could sometimes require additional staff, another nurse to scrub in to help monitor, the baby on the parent's chest, another person in the operating room just to reduce risk. This could be difficult in some cases because in some institutions, operating rooms are pretty small and there's a lot of people already, there's a lot of equipment, and the idea of just adding one more person to facilitate skin-to-skin care was prohibitive to some providers. It can also mean changing basic things about how cesarean births function. It can mean changing how monitors are attached to a birthing person's body. Where does a blood pressure cuff go? And when can certain routine procedures take place, like taking the baby's weight, measuring them, recording their APGAR scores, and when they can place their eye drops. It requires an investment, not only from doctors and nurses and other medical staff, but as well as hospital administrators. These things are all possible, and in the signature article, we get to give multiple examples of how providers have successfully made this change. In one study, researchers found that while hospital staff were initially reluctant to change, how they did cesarean births, their opinions really changed once they saw the benefits of skin-to-skin care after cesarean and what it did for families. So sometimes seeing is believing, and when that happens, people will work really hard to bring benefits to birthing families. So these are just some of the main reasons that hospitals might not allow skin-to-skin care after a cesarean. And I think it's really important for us to understand the perceived barriers to skin-to-skin care after a cesarean from the provider or from the hospital's perspective, because it can be really useful as you try to advocate for yourself, or if you work in a hospital setting, advocating for change within your own institution.
Yeah, and thank you, Sara, for that. I think that other people may find that the article is helpful because it gives examples of how specific hospitals change their cultures and practices. And like you said, it's really more of a cultural shift and shifting some logistics. There's not, some huge barrier that means it would be unsafe for babies. It's more of just changing people's habits, which we all know changing habits can be hard. So what are some of the newer research studies finding that you found interesting when you were looking at the research for this update?
Yeah, so some of the newest research on skin-to-skin care looks at the benefits for preterm babies. And a lot of this echoes, what researchers in Colombia were finding in the late 1970s about, how fragile a baby can be and yet still benefit and even be discharged from a hospital by just remaining very close to the birthing person's chest. So a really recent study from Norway in 2023 wanted to look at the impact of skin-to-skin care basically as immediately after birth to very preterm infants who are born vaginally and via cesarean. And they wanted to know what the benefits could be to this, special category of babies. The study included 108 babies who were born between 28 and 31 weeks. And of those 108 babies, 62 were born via cesarean. All of the babies in this study were first placed in a warming unit to be assessed and stabilized after birth before being split into one of the two groups, the group who got skin-to-skin care and the group who was immediately taken to the NICU. So the babies in the skin-to-skin group were transferred to their parents' chest as quickly as possible after being initially assessed. And those babies were allowed to be skin-to-skin with their birthing parent for up to 2 hours before eventually being transferred to the NICU. And the researchers had some really interesting results from this study. They found that rates of hypothermia or low body temperature, as well as hyperthermia or a too high body temperature, were lower in the group of babies who had skin-to-skin care compared to those who were placed in an incubator. The babies who got skin-to-skin care after birth were also more likely to be discharged early to home care then those babies immediately taken to the NICU, as is the standard procedure at that institution. Over 50% of the babies in this study were born by cesarean. So that led researchers to suggest that this is a safe thing to do for very preterm babies, regardless of how they're born, if they're born vaginally or via cesarean.
Yeah, that was a really fascinating study. Another one that I liked was a 2019 study by Lanning, which I got to meet one of the authors when the study was taking place, and she was telling me about it. And so it was really cool to see it published. This was a quality improvement project at a hospital where volunteer doulas were trained on how to be that person to help with skin-to-skin care after cesarean in the operating room. So a lot of hospitals will say, well, we don't have the staff to have a staff member assigned to support. Well, this hospital actually trained the doulas to be that person to make sure that the parent didn't drop the baby and that everything went smoothly with skin-to-skin care. And so they found that among 58 infant parent pairs who had a scheduled cesarean, all of them were able to initiate skin-to-skin care with the help of the volunteer doula. It took about 11 minutes between when the baby was born to the start of skin-to-skin care on average. And 1/3 of the pairs were transferred to recovery rooms while they actually kept the baby on them the whole time. And the authors found that the presence of the doulas made it easier to provide skin-to-skin care and that it had a positive impact on the birth experience for the parents as well. So I thought that one was really cool. Another important area of research that we found is that skin-to-skin care can support breastfeeding and chest feeding for Black birthing people and babies. So as you mentioned earlier, Sara, cesarean rates do differ for different racial and ethnic communities in the US. This means because Black and brown babies are more likely to have a cesarean, they are in turn less likely to have skin-to-skin care. And researchers have proposed several theories for why cesarean rates are higher in these groups, sometimes focusing on rates of medical interventions and socioeconomic status. But these factors do not explain the differences in cesarean rates by race and ethnicity. And experts in racial health disparities, such as Dr. Joya Creer-Perry, OBGYN and founder of the National Black Equity Collaborative, often clarify with this explanation. Quote, race isn't the risk factor, racism is, end quote. So researchers believe that the medical racism of healthcare providers, both systemic racism and individual prejudice cases, has led to higher cesarean rates among Black and brown birthing parents, and that this topic demands our attention. We do have a whole article on the subject of racism and anti-racism in birth work and healthcare that you can read at evidencebasedbirth.com/anti-racism. But one other factor that's important to this article is that racism has led to lower rates of exclusive breastfeeding or the practice of only nourishing a baby with human milk for at least the 6 months of life in Black and Indigenous communities compared to other groups. The reasons for this disparity are rooted in histories of enslavement, land theft, racism, racist institutional practices that destabilize family groups, and aggressive marketing of formula or distribution of formula by the government within these communities. In contrast, skin-to-skin care is a free, beneficial practice that could help improve chest feeding and breastfeeding rates. But despite the well-documented relationship between higher cesarean rates and less access to skin care, we really don't have a lot of research yet addressing how skin care could improve these disparities and help mitigate the effects of racism. But there was one really cool research study. You only hear that EBB, really cool research study. We love research that addresses these issues. It was published by Mirwood et al. In 2019, and they were following the implementation of the Baby Friendly Hospital Initiative and its impact on births in the southeastern United States. So they looked at more than 39,000 births across 31 hospitals in Mississippi, Louisiana, Texas, and Tennessee. And this was an observational study. They were looking to see if the baby-friendly 10 steps to baby-friendly care could lessen racial disparities in chest feeding. And they found that providing skin-to-skin care after cesarean was significantly associated with higher rates of initiating breastfeeding and exclusive breastfeeding, with the greatest impact among Black infants. So Black infants also, if they roomed in with their parents, were 1.54 times more likely to exclusively breastfeed than those who did not. And Black babies who had skin-to-skin care after a cesarean were 1.65 times more likely to nurse exclusively while in the hospital compared to those who did not. So in the article, we also link to resources for lactation support and how you can seek out Black and person of color care providers and birth workers, with links to different episodes and different models of care, as well as ways you can seek out doula support for this issue. So Sara, another thing that we added to the article was a section about gentle cesareans. So can you talk with our listeners about what is a gentle cesarean?
Yeah, so in 2008, researchers Smith, Platt, and Fisk first described what they called a natural cesarean as one where a parent is involved as an active participant in their birth, and the baby is transferred directly onto their chest for early skin-to-skin care. So a natural cesarean is maybe the early term for this type of cesarean birth. Other terms that get used are family-centered cesarean, or probably most commonly a gentle cesarean. But all of these terms refer to the same basic idea: to mimic a vaginal birth as much as possible during a cesarean. So that looks like having pauses to allow the birthing parent and their family to see the baby's head emerge. It looks like allowing the rest of the baby's body to slowly then emerge from the incision, placing the baby on the birthing parent's chest rather than being whisked away to a warmer. This can include lowering the drape or even using a type of surgical drape that has a clear window that you can see through. So techniques can vary depending on the hospital and the provider. But overall, the main focus of a gentle cesarean is to put the infant on the birthing parent's skin as soon as possible after birth, and to avoid unnecessary separation of the infant from their parent. So doing what they can to make a cesarean birth a birth where the parent is involved, is aware, can see what's going on, and saying that, just because you're having this type of birth, it doesn't mean that, you need to be separated, that we can adjust how cesareans are done to promote this really beneficial thing, which is skin-to-skin care.
Yeah, and I think we couldn't really find any new research on the whole package of a gentle cesarean, but we do know there is research that the skin-to-skin care aspect of it is very important. And I also like to educate families that delayed cord clamping can be part of a gentle cesarean, so that you can get that delayed cord clamping that's on your birth plan, even if you're having a cesarean. So up next, I wanted to talk a little bit about the professional guidelines on this topic, because when we first published this article, there were 0 professional guidelines on doing skin-to-skin care in the operating room. And so we were really happy in this update to be able to share that quite a few organizations now support this practice officially. So in 2018, the American College of Obstetricians and Gynecologists published their opinion on how to optimize breastfeeding support. And they stated that skin-to-skin contact is possible in the operating room after cesarean, and they acknowledged that parents who have a cesarean birth will need more support from their care providers to establish and sustain breastfeeding, and there may need to be some additional monitoring if the parent was treated with opioid medications during the surgery. The Society for Obstetric Anesthesia and Perinatology recommends that skin-to-skin care begin as soon as possible in the operating room, or whenever appropriate given the condition of the birthing person or baby. They state that not only does skin-to-skin care support breastfeeding, but it also eases the transition to the outside world for the baby and helps with bonding. And they recommend practical ways that anesthesiologists can support immediate skin-to-skin care after cesarean, such as moving monitoring leads and electrodes to the birthing person's back, arranging equipment to provide space for a nurse to assist with skin-to-skin care, and using warm blankets or warm forced air to increase the temperature in the operating room. The National Institute of Health and Care Excellence guidelines from the United Kingdom state that birthing parents should be encouraged to have skin-to-skin contact with their baby as soon as possible after birth, and they recommend against separation of a parent and their baby within the first hour of birth for routine procedures. In 2021, they updated their guidelines specifically to include a recommendation that babies born via cesarean receive skin-to-skin contact after birth. We also have the Royal Australian and New Zealand College of Obstetricians and Gynecologists officially recognizing that skin-to-skin is an important part of recovery after a cesarean. And in 2023, the American College of Nurse Midwives recommended that both skin-to-skin care and gentle cesareans be offered and provided by healthcare workers in the postpartum period to those undergoing a cesarean birth by request. So we have shared a lot of research with you today. I think I want to also point out that separation is a difficult topic. A lot of times I talk with people who, like me, were separated temporarily from their baby after birth, and it can add an aspect of trauma to the birth experience that is often preventable. So I'm really excited that we can help provide this evidence so that cesarean families and birth workers and healthcare workers can advocate for themselves and use this information to make change in their hospitals. And with that being said, Sara, I appreciate your work on this. I was wondering if you could wrap this up by sharing with our listeners, what is the bottom line on this subject?
Absolutely. So the research demonstrates that both immediate and very early skin-to-skin care after a cesarean birth is safe and beneficial. And that includes the skin-to-skin care that starts in the operating room. For parents interested in any type of body feeding, from nursing to pumping, skin-to-skin care after a cesarean can help make that possible. And it can be a really important part of your, lactation journey. Skin-to-skin care is important, and many birthing people want this option regardless of how they give birth. However, low rates of skin-to-skin care after a cesarean and reports from researchers suggest that families and hospital staff face multiple barriers to either accessing skin-to-skin care after a cesarean or to providing it. The evidence shows that skin-to-skin care after birth is possible and the best practice for birthing parents and babies. Hospitals that are not currently supporting skin-to-skin care after a cesarean should act immediately to make the changes necessary to support this best practice. If a hospital staff member tells you that it's impossible for you to recover with your baby after a cesarean, that statement's false. Making the switch from routine separation to keeping parents and babies together actually is possible, and many hospitals have already done so. Although separating parents and babies after a cesarean might be perceived as more convenient, in the end, keeping birthing parents and babies together after a cesarean is a safe, evidence-based, and beneficial practice. Here at EBB, in our childbirth classes, we teach students that it might be helpful to ask your provider these questions during a prenatal visit. What is your cesarean rate? Or what is a cesarean rate at this hospital? If I have a cesarean, is it possible for me to have skin-to-skin care with my baby in the operating room? Are parents and babies able to do their post-op recovery in the same room? If skin-to-skin care is a high priority for you and your chosen facility does not support skin-to-skin care after a cesarean, or if they routinely separate birthing people from their babies during recovery, you might want to consider looking at other birth options in your community, if possible. You can also print off a copy of the handout of this article and share it with your providers. Ultimately, as more families, birth workers, and healthcare providers request skin-to-skin care in the operating room, more facilities will begin to offer family-centered cesarean care.
Thank you, Sara, for everything you did on this article. And I want to remind our listeners again to go to ebbirth.com/cesarean care to read the full-length article, see all of the scientific references, and download that free one-page handout. We also have different lists of resources, including links to films, beautiful, gentle cesarean births, and links to other podcast episodes and articles that might be helpful for you. So thank you everyone for listening, and please go out and share this evidence far and wide so we can get this practice available to more families. Thanks, everyone.
Bye. Thank you.